This is Next Steps for Seniors with your host, Wendy Jones. Each week, Wendy brings resources and information to help guide you through those next steps with elderly parents and loved ones. You can follow, subscribe, and share on your favorite podcast platform. If you have questions or topic suggestions for Wendy, you can call us at 248-651-5010 or email at hello@nextstepsforseniors.com.
Welcome to Next Steps for Seniors, Conversations on Aging. I'm your host, Wendy Jones, and our topic today is going to be a little unique in that it's called Doctors at Your Doorstep. So this program was really designed for our families, for our seniors. I have such a passion to educate and inform people really of the next steps. No pun on words, because it's called Next Steps for Seniors. But the reality is nobody wants to think about the next step. We all want to just retire and live our best life. And I'm all good with that, except everybody ages. There's no magic pill. And 70% of people in the United States need some kind of care as they age. So why not talk about it? That's my motto. Well, let's talk about the things nobody else wants to talk about. And that's why you're listening to this show too, I'm sure, because you know that's what we do. And our guest in the studio is Amani Wilson, who is a care coordinator. Hello, Amani. How are you today?
Good. How are you?
Glad to have you here. And Suzanne Garay. Did I say that right?
You did.
Okay. And she is a nurse practitioner. So how are you, Suzanne?
I'm good today. Thank you for having us.
Absolutely. And Doctors at Your Doorstep is an interesting concept because I don't know how many of our listeners know that you can actually have a physician come right to your house.
Not a lot of people know, actually.
I know it's a rarity. It's been around forever, but people just don't know. And that's why Doctors at Your Doorstep is here today. So we're going to start first. We're going to talk with Suzanne for a little bit about, what do you see, Suzanne, in our aging population? What are some of the things that bring you to a hospital, right, that you see happening in our elderly population as we age? What's the most common?
So one of the most common things that we see is urinary tract infections or UTIs or bladder infections, as other people might call them. Those are usually the one thing that starts the kind of the decline of the patient. It leads to falls, mental status changes, not taking their medications like they're supposed to, and then, not eating, not drinking, and then it leads to dehydration. So there are several things that can come from that one.
And it's so common, isn't it? Like,
very common.
And is it true once you have one UTI, it's more common to get them also?
Definitely. Yes. Yeah. I believe that if you're not recognizing the symptoms and you don't know what's going on with your body, you think you're okay, but when people on the outside really start talking to you and realizing you're not okay, there's something missing, something's wrong.
So what are the symptoms? That's a great question.
So everybody's different. As we're younger, most of the times you'll have fever, chills, stuff like that. But as we get older, our immune systems change. So we're not having those same symptoms we did maybe when we were younger. So a lot of the elderly, we see mental status changes, patients arguing more than what they used to, doing things differently than they used to. Maybe some burning with urination. Maybe their urine's a different color than it used to, or sometimes the urine will have a little bit of an odor to it. And that's also indicative of, dehydration. So if you're not drinking enough water, then your urine can also be symptoms. So it's very easy to do a urine test just to see where we're at, what's going on.
Well, isn't confusion too? I've heard this repeatedly, people who just don't seem to, a lot of people are like, oh, my mom's getting dementia. When it's just a urinary tract infection.
We get that a lot. Yes. Yes. And you just have to know your patient. You have to know where they're at. And you have to just kind of say, is it really true dementia getting worse, or is it a bladder infection? And like I said earlier, it's easy just to run a urine test and figure it out.
Because the difference between the two is significant.
It is significant.
And if it's just a UTI, we sure as heck need to know that. And I don't think people realize how common it is.
Yes.
And that you may not even know you have it.
Right. You're right.
So it's just a urine test. So you could go to your primary care physician.
Yep.
You can get a urine test anywhere.
Yes.
Nowadays, you can probably get it online.
Urgent care. Sometimes urgent care, they can dip it right then and there, and they can just tell, yes, you got, this, and this in your urine, and they'll go ahead and give them antibiotics. And
And that's all it is that just antibiotics will help cure that?
Yes, antibiotics will help cure that. The right antibiotic. If you really want to get a true test, you do the urine, the urinalysis, and then we do the culture. And the culture will tell us what bug you have in your system and what antibiotic is resistant or sensitive to that bug. So then we make sure they get them on the right track. And then we kind of go from there, just kind of keep them straight.
I'm sure our listeners are like, why are we talking about UTI? But I cannot stress enough. It's so common. So like out of 10 people, probably like 7 or 8 have had UTIs, yes, right? I mean, it's this common. And so if you're wondering what's wrong with you, how easy is it to go get a urinary test? Right. So that's why we're talking about UTIs. Yes. So thank you, Suzanne, because it's important.
It is important.
And to have a primary care physician. So Imani, that's what I'd like you to share with our listeners is why is a primary care, and we call them a PCP.
Right, PCP.
Primary care physician, so important.
So having a PCP helps prevent you from going to the hospital. Like Sue was saying, having a UTI can increase your decline. And if we can prevent that decline and send you to the hospital and keep you in your home, that's why a PCP will be important to you and your health. We definitely strive to keep you in your home, keep you out of urgent care, because there's more.
It's overwhelming, I think, for anybody to go to the hospital, but definitely for an elderly person.
Yeah,
and it's a lot of work.
It's a lot of work.
Driving out there.
Waiting. You have wait times up to an hour before you even see a urgent care doctor. Mm-hmm. So I think that's why Doctors at Your Doorstep is healthier, because you're in the home and you can see your nurse.
Well, hold on. We're going to transition into that in a second. So a PCP is also a gatekeeper, right?
Yeah.
It's somebody who knows everything about you. My PCP is my new best friend.
Yeah.
And I tell her that every time I see her. I'm like, you're my new best friend. And she just giggles. But the truth is, as we get older, we need the experts. We need the people who know what they're doing. And that's why I think my PCP is my new best friend. And if you don't have a PCP, it's important. Mm-hmm. It's important to have someone that you trust. And you can call our office because we've got a lot of good ones that we work with. But moving into the Doctors at Your Doorstep, what's fascinating about what Imani and Suzanne do, and the name of their company is Integrated Visiting Physician Solutions.
Yeah, it's a mouthful. Say IVPS for short.
Okay, thank you.
Yeah.
I was going to say it really fast, and I'm like, I'm not going to do that.
IVPS is easier.
IVPS. Yeah. And tell us what IVPS does, because you go right to the home.
We go right to the home, yes. So, for instance, Suzanne will go straight to the home and see the patient, and she will do an evaluation. And she's basically your PCP in the home. You don't have to go out of your home to see your PCP if you qualify for that service.
Okay. Right. So most people don't realize this service is even available.
Correct.
And it's very important to know that, yes, it is available, and physicians, nurse practitioners, they can come to you. You don't have to trudge through the snow and the wind and the rain and the hurricanes and whatever else. Get in your car and have your loved one take the day off work or whatever and drive them. Like you just said, you actually can have someone come to you. Yes. Now, the key is, and this is available all over the country.
Yes.
You happen to be right here in Michigan, which is fantastic. But I want you to know the key is, do you qualify?
Correct.
Okay, and Imani's going to tell us what is considered a homebound qualification. How do you know that you can get a house call?
So you know when it is at the point of you are having a hard time getting out of the home. If a loved one has to maneuver you in and out of your bed and into the car, and now that time is taking 20, 30 minutes just to maneuver you. If it's anything that's going to affect your health, if it's going to, if it's going to prevent you from, sorry.
No, it's okay. Yeah, no. I mean, we want people to be able to we want to help people who are in their home.
Yeah.
So if they can't get in the car is a big one. They can't, I mean, they can drive, but maybe
they can drive, but they have a hard time, or they shouldn't be driving. We have a lot of people that can drive and shouldn't be driving.
Well, we already know that. and so visually impaired.
Yes. Anybody with a walker, a wheelchair, anyone who's
bed bound, anybody that cannot really get out of their home safely, it's really a struggle.
If you've had a recent surgery or something like that, that's keeping you at home for the next. I mean, I've had people that have had surgery and then they're like, I got to go for my 7-day visit. And it's like, are you kidding me? You can't even drive.
Yeah, exactly.
How are you going to do that? And you can have someone come to your house. So thank you.
Yeah.
And this is covered under insurance.
It is covered through insurance. Most insurances are covered. There is some iffy ones like Medicaid. It's not covered. But Medicare.
But that's just with your office, right? Sometimes they are, or most of the time they're not.
Most of the time they're not. Yeah. But most insurances do cover it. Yeah. Medicaid is a tricky one, but most major insurances cover.
Do you accept private pay? Like, could someone pay for you to come to the house?
They could pay for the visit. I believe it's $250. But if you have insurance, it's just easier that way.
So this service is available to you. If you are struggling getting your loved one in the car and to a doctor's appointment, please have the doctor come to you. If you're in Michigan, IVPS. If you're elsewhere, Google in-house physicians, right?
Yeah,
Visiting physicians.
It's just that easy.
It's that easy. We're going to take a quick break. When we come back, we're going to give you a few stories and ideas and thoughts on how and what is the best way to use these visiting physicians. We'll be back in just a moment.
Hi, I'm Wendy Jones, host of Next Steps for Seniors Conversations on Aging podcast. Did you know that over 25 million Americans experience bladder leaks? Incontinence can happen to anyone at any time, and when it does, incontinence products are a necessity. But it can cost hundreds of dollars per month to purchase these products, which is why we're partnering with Airflow Urology to help you. Airflow Urology provides medical-grade incontinence care essentials like adult briefs, male guards, catheters, and more for free through your insurance. With Airflow, your favorite bladder control supplies are sent right to your doorstep with discreet monthly deliveries. Customers have reported close to $200 a month in savings with Airflow Urology, and over 2 million people have trusted Airflow. You can verify your insurance benefits by going on and filling out a quick 2-minute form. Check your eligibility. Visit airflowurology.com. That's AEROFLOW urology.com.
This is Next Steps for Seniors with your host, Wendy Jones. Each week, Wendy brings resources and information to help guide you through those next steps with elderly parents and loved ones. You can follow, subscribe, and share on your favorite podcast platform. If you have questions or topic suggestions for Wendy, you can call us at 248-651-5010 or email at hello@nextstepsforseniors.com.
Welcome back to Next Steps for Seniors, Conversations on Aging. I'm your host, Wendy Jones, and as you all know, my passion, my desire is to help seniors make life easier for them, and that is why we have the IVPS people with us today. And I'm going to say it really fast: Integrated Visiting Physician Solutions. So we need to know that you can bring a physician right to you.
Yeah.
So I guess my question first, Amani, before we get into a story, because I know Suzanne's got a good one. So let's say you have a PCP that you've had that you drive to for the last 15 years. Mm-hmm. And now you want one to come to your house, and your one that you've been driving to doesn't make house calls. You have to physically switch who your PCP is with your insurance provider, or can you have both?
You can definitely have both. You can have both. You can have your PCP that you've seen for 15 years because that's your best friend, but you need also somebody to come out to the home. If you do decide that you don't want your PCP, you can call your insurance and change it over to the provider that we send out to you, but you can definitely have both of them.
And insurance will cover both?
Insurance will cover both.
And how often does it cover? Every 6 months? Do you know that?
I don't know.
I know it's a billing question.
Yeah, it's more of a billing question.
She's like, same thing.
The numbers is not me. I'm not for sure about billing. As long as it's not the same day as your PCP, the billing should be fine.
Right. And Medicare is fantastic. So,
right.
Yeah, exactly. Mm-hmm. Okay. So good. Thank you. People, I would be hesitant to leave my physician who knows me since I was 40.
Exactly.
And was probably too much, right?
Yeah. But also we can communicate with your PCP, and anything that they've done for you, we can integrate that into our system and we can now know you as their best friend as well. Now we can become your best friend.
My language.
No.
Okay, you're going to use that. I can tell. Okay. So let's talk about if you go into the hospital. So do you help coordinate a little bit? Or what do you...
While at the hospital, we let that doctor take care of you. You have your discharge and we'll follow up with you. But that doctor, that hospital doctor, will take care of you at that time. But we can communicate and say, okay, once you discharge, we'll take it from here.
Got it. Okay. Yeah, good to know.
Yeah.
All right, Suzanne's got a great story for us. So tell us, we want like a real life example of what you do every day.
Okay. So I do a couple different things with IVPS. I do primary care, which is internal medicine. I also do pain management, so I help with that. And then I just recently started to get into wound care with advanced wound care. So I have a patient who was in a rehab center for quite a while. A young lady had a huge wound on her bottom. And so we finally coordinated, got her home. She is bedbound. She has 2 kids, husband. She's not able to do stuff in the home. But, I go in every week. I change her dressing. Her is getting better. She's able to sit up in her chair longer. And just the other day when I was there, she was crying. Thank you for helping me. I really appreciate it. You're such a nice person. She gave me this little rose that she had.
Nice.
So, it's rewarding to not only help people, but to also see these wounds heal up and them getting smaller and smaller, and patients not having the pain, not having infection, not having these health issues because of the wounds,
And wounds are fairly common as we age,
They
too.
are very common.
How do they happen? Just out of curiosity.
So
Is it
most times
in one place?
Most times it's pressure, where somebody is just, they set mom and dad up in the chair and they just leave them there until it's time to go to bed. And, you have to move, you have to get blood flow to your bottom, you got to get blood flow to your feet. And if you're in one position too long, it starts to break down and then you end up with wounds. You would be surprised at the amount of wounds that we see in the home. It's almost horrific.
Oh, gosh, it's heartbreaking. And they're so unhealthy.
Yeah.
If left untreated,
Yes.
what can
Sepsis
happen?
and death.
Yeah, sepsis is major. That is not something to take lightly.
It is not.
And it's basically an infection, a bacteria infection,
Yes,
right?
your whole bloodstream.
I think I'm a doctor. I just play one on the radio.
It's okay.
It's all good. I respect
Knowledge is good.
I respect that you're a nurse practitioner. You went to school a lot longer than I did. But I do feel like the most common places are like your heels, your feet, your bottom, your back, right?
Shoulders, head, ears. I had a patient not too long ago who was bedbound patient, and the daughter flipped her over, and the wound was her whole bottom and half of her back. Oh. And the daughter was like, "What is that white stuff?" I said, "Ma'am, that is your mom's spine that you're seeing." And she's like, "Are you gonna be able to heal this?" And I'm like, I don't know. Unfortunately, we'll try and we'll do our best and we'll try to keep it clean where it's not getting infected. But unfortunately, the patient had other comorbidities that was going on and she had passed away in the home.
So how does it get that bad from not moving at all, right?
Yes. If you're not treating it properly, if you think you can handle it at home, family members think, well, it's little, I can take care of it. I'll put some Vaseline on it.
Little is like a penny. Anything over a penny should not be handled.
Should not be handled at home. They should call in an expert.
We're just giving you a visual.
Yeah. Anything that, has been there longer than a week or two, you really need to start calling in an expert, whether, it's calling IVPS for the wound care, taking the patient to the emergency room. I know we're trying to avoid that. But sometimes with the wounds, you need surgical debridement under anesthesia to get away from some of that, dead, rotted tissue. It's just a whole cascade of things that happen. I know I could talk about.
Don't let it go untreated. I guess the key thing is do not let it go untreated.
That is the key thing.
Yeah. And it needs weekly attention.
It does need weekly attention.
Preferably daily, but at least weekly.
Right. And then, we always step in with home care. So, I'm not somebody that can go out to the home, every day and do a dressing change, but we do, I have home cares and partner with home cares, and we have nurses go out a couple times a week. They are my eyes and ears. They communicate with me quite frequently, send me pictures, send me text messages, and then we're able to, change dressings and change orders if we need to as we go along.
It's so important. Thank you for talking about wounds, because honestly, UTIs and wounds are like the things that when people call our office, just so you know, these are the 3 things that are the biggest deal to us. Number 1, you're not going to want to hear this, guys, but weight. If you are over 200 pounds, it is a significant increase in care because you need 2 people to help you versus 1.
Yep.
Right.
So that's number 1. Number 2 is if you have a wound. because some assisted livings can't even take you in if you have a stage 4. They stage them.
Right.
1, 2, 3, and
Yes,
4,
they
correct?
do. Yes.
See, I do play a doctor.
You do well.
Okay. So anyway, yes. So it's important to know, like, if they call in and they're like, oh, I have, a stage 4 wound, and right away we're like, okay, we got to get that fixed.
Yeah.
So, those are the things that are important that you need to know that are that important, right? And anybody who talks about their loved one being confused or having dementia and Alzheimer's, the first thing everybody on the phone says is, have they already been checked for a UTI? So these are the things that when you call our office for help, this is what we see every single day. And that's why the two of you are here today from IVPS, because we need to know what to do. So I would love now, Amani, if you could share your information on how people could get a hold of you if, in fact, if you're in Michigan. Now, if you're not, go to Google. And it would be visiting physicians or home physicians.
Yeah, home physicians. Or even if you're not in Michigan, you can definitely contact your insurance and they can suggest providers who are in network with your insurance. But for anybody in Michigan, you can contact IVPS at 248-327-6196. If you're new, you can hit option 1 and speak to intake, and they'll get you straight there and take care of you.
And how long does it usually take to get an appointment anywhere? I mean, is it like within a week?
Within a week. If you're fairly close by, 2 to 3 days. But within the week, we can get you scheduled and seen.
And what would someone expect on the first appointment of someone coming to the house? First of all, make sure they show their ID.
Yes.
Make sure that you don't open the door till you know exactly who they are and have a scheduled time. Okay, I'm sorry.
Yep.
And we drive cars. We have company cars that have IVPS on them. So if we're showing up at your house, you'll see the car.
Yeah.
People are like, oh, I didn't know you were coming, but I seen your car, so now I know it's you.
Okay.
Yep. And we have the issue of they don't know that somebody is coming out, or they've seen somebody and it's not us, and that is a big issue. But
do not open your door. No,
don't.
What should they expect at the first visit? Whoever wants to answer that.
Oh.
We're going to come in, we're going to do an assessment. We have consents that are being signed. We're going to assess the patient, go over your med list, talk about allergies, kind of just see what your medical history is. What's concerning for you? What do you have that we need to address? We can do lab work in the home. We have x-rays, EKGs. We do ultrasounds, cardiac Dopplers. We have a lot of resources of stuff that we can do in the home. We also have a podiatrist on board with us. We have a pain management palliative doctor that's on board with us. So we do have a lot of resources of stuff that we can take care of in the home.
Okay, so you said something really important, and this is a huge pain for people, to go get an x-ray. So you can actually bring these diagnostic tests right into the house?
Yes.
Yep. So we have a company that we work with, and they have a big old machine that goes straight into the house, and they do it then, and within next day, honestly, we get the results.
So results are quick, and it's convenient.
Yeah.
And is there an extra charge?
I don't think so. I think they bill the insurance.
It's all covered
directly.
under insurance.
Yeah, because I don't think if it's not covered, they let us know, like, hey, it's not covered.
It's probably, if it's medically necessary, it's probably covered.
Yeah. And we have to document that it is medically necessary.
Of course. And if not, then maybe you just pay for it. I mean, at this point, the convenience and all of that coming into the home, huge difference.
Yeah.
And you can actually private pay to begin services anyway. You said $250.
$250 for the initial visit. And then forward, that goes to billing. I'm not for sure. But afterwards, I believe the price goes down to $150.
Mm-hmm.
But that first initial visit, $250.
So this is your answer. Please do not try to drag your loved one into the car. If they're at a point that they are not able to easily transition, let's bring the doctors to them. You're listening to Next Steps for Seniors, Conversations on Aging. Thank you for what you both do every day for our seniors and caring for them. Have a blessed day, everyone.